Well, you may have seen him in the news. Patients from all over the world fly to Jacksonville just to seek his expertise. He's one of the world's most well-known eye surgeons, and he is known by many as the best-kept medical secret in Jacksonville. Today, Dr. Gulani is joining us. We're going to learn more about astigmatism and the advances in astigmatism surgery. So thank you so much for joining us once again, Dr. Gulani. We appreciate, as always, your expertise, and especially with something like this that for a lot of people, they don't. What is exactly an astigmatism for those that might not have suffered from this condition?
So our eye, if you think about our eye as a camera, the front clear viewfinder of our eye is called the cornea. The shape of that cornea decides our vision, or what we call the glasses prescriptions. So if the front cornea is very curved, we are nearsighted. If it's flat, we are farsighted. And if it's shaped like a football as opposed to a basketball, that's astigmatism. Okay. So you could be born with astigmatism, or you could have it following previous surgery like LASIK or cataract surgery. And most usually, in many farsighted or nearsighted people, astigmatism is coexistent.
And so how does that affect your vision then when you have an astigmatism?
So it affects vision. Patients may complain of blurry vision, maybe eye fatigue, eye strain, and sometimes it may be not diagnosed because the level is so small, but it can be detected not only in a routine eye exam, but with new advanced technologies today, we can determine the level of astigmatism, even if it's small enough to measure, and also the type of astigmatism, and that's correctable.
And that's something that is correctable through surgery?
Yes, with today's technologies, advanced lasers, diamond instruments, and artificial lens technologies, absolutely.
Well, I was going to say, that leads me to my next question, because you've actually invented some instruments that are used in this procedure to then have surgery for an astigmatism.
Yes, and today astigmatism, the way we'll come to our protocol, I break down astigmatism into 4 kinds of patient scenarios. Okay. One is astigmatism that you're born with, and in these cases it may be associated with nearsightedness, farsightedness, or even after 40 reading glasses. The second level is astigmatism with cataracts. Third section is patients who've had previous LASIK or cataract surgeries and now have astigmatism. And the fourth level is patients with associated pathologies like radial keratotomy, corneal scar, keratoconus. So once you select what category your patient falls into, and again, going back to my concept of how you have to design the surgery to each patient, young patients fall into the LASIK category, or types of laser techniques. Nowadays, we do the non-cut technique without blades. And patients in the cataract age group can take advantage of their cataract surgery and get corrected by astigmatism.
So are you incorporating different types of surgery to correct more than one problem? It's just, how does it work up? So if you are younger, you would do a certain type of surgery then to correct the astigmatism? Like you said, LASIK, you're almost combining it? Is that
You can combine it too.
Okay.
So the concept again is, every time we discuss these points, is I believe in designing the surgery to each patient uniquely. Look at astigmatism and what else do they have? Are they nearsighted, farsighted? You can do a laser technique. Are they also having cataracts? Do a cataract surgery, put in new generation lenses inside the eye permanently, they're corrected forever. If someone has had cataract surgery and is now wearing glasses or contacts for astigmatism, do LASIK on top of that.
See, that's incredible to think, like you just have this thought that when you go in to get a procedure done, you're going to get this procedure. But then maybe down the line, you're going to get another procedure that's going to fix this problem. But you're saying it's almost, essentially, you can combine it and get, everything done all at once.
Customize it to the patient,
And I know that that's something that you really speak a lot about, is there is no one set fit for a patient. Each one, when they walk into your office, gets a customized approach. Is that pretty much? Always,
I believe. In cookie cutter surgeries you cannot have, because each eye is so individual with its optical errors. I use the word, like we did in our last segment, opportunity. If the patient is presenting with glasses or contacts, use that as an opportunity to correct all the refractive errors to the best you can with the least amount of surgery.
Right. Right. And what's a recovery time then for someone who might have a typical surgery?
In most cases, surgeries are done outpatient with numbing drops, maybe mild sedation, and lasts about a few minutes, and pretty much a day or two of recovery, again, depending on techniques.
Well, since you're on the cutting edge, no pun intended, with a lot of the different surgeries and whatnot, and how you're incorporating this together, what do you see coming down the line specifically for astigmatism surgery?
Very exciting future, as I'm leaving in a month now again to teach in Europe on these technologies, where diagnostically today with 3D technology we can determine the amount of astigmatism and the pattern, and so plan the surgery. Treatment-wise, advanced laser techniques today where we correct astigmatisms of different orders, primary, secondary, tertiary orders, which was unheard of till a couple of years ago. And then new generation lens implants that we can put into cataract patients and correct it, called toric, like toric contact lenses. So very exciting how you can correct astigmatism.
And you just said you're getting ready to go to Europe to teach a few classes. What is it like when people come from all over the world to see you, to get your personalized perspective on how people can just change their vision forever? You know, some people, you know, will go in thinking that they're going to have cataract surgery, but they walk out with 20/20 vision. You know, it must be a pretty rewarding experience.
I do. I think it's a privilege to be an eye surgeon, and that's why I translate this into my passion to be the best I can.
Yeah, well, thank you so much for your perspective, Dr. Gulani. Safe travels to Europe. We appreciate you.